I'm Todd Brusko. I'm one of the investigators here at the University of Florida in the Diabetes Center of Excellence. And my lab is primarily focused on two things: understanding how diabetes occurs, understanding the genetic influences of it, and then after that, understanding how we can influence the disease process. We have a project that we're proposing here that we'll introduce in this next animation that'll hopefully give you an idea of what we are hoping to do.
The incidence of autoimmunity and type 1 diabetes is growing at an alarming rate. Insulin therapy is life-saving, but is not a cure and does not address the cause of disease. Type 1 diabetes is a disease that revolves around the pancreas. It occurs when a person's own immune system targets the pancreatic beta cells that produce insulin for the body. Environmental change causes these beta cells to be targeted by the immune system and destroyed. This occurs from an imbalance in population of white blood cells that favor those responsible for beta cell destruction. A number of prior studies suggest that if a population of rare but powerful regulatory T cells could be bolstered, it could restore balance in the immune system. To combat this autoimmune attack, our hypothesis is to harness a patient's own regulatory T cells. We will then bolster their activity by coating them with dissolvable nanoparticles, delivering a combination of growth factors. We expect that once injected into a patient, these reinvigorated cells will track to the pancreas and re-educate the immune system.
So if you think about the way most drugs work, it's a simple drug that targets a pathway. Our approach is actually quite different than that. It's to harness the power of a person's own immune system to isolate out a population of regulatory T cells to shut down the autoimmune attack. We think this is going to be more specific and hopefully avoid some of the off-target effects of drugs. This will impact patients with type 1 diabetes, particularly targeting the underlying cause of the disease process. So our hope is that by introducing our new therapeutic approach, we will stop the process in its tracks. What we're asking for is your support to fund the science. We have a team of immunologists, biomaterials engineers, and clinicians to move this towards the clinic. So with the help of all the investigators at the University of Florida Diabetes Center of Excellence, we'll appreciate your support.